Hello, I am Yusha Patel, and in this video, I will be talking about the correct way to use Lovanax. This video has been made so that you can effectively counsel your patients on the Lovanax technique. Lovanax is a self-injectable, and while you are counseling your patients on Lovanax, you want to keep in mind that many of these patients may have never used self-injectables in their lives. So it is possible for them to not have enough confidence injecting themselves with Lovanax. Your goal during counseling is not only to show the correct technique, but also to instill confidence in them so that they feel comfortable using Lovanax at home. Let's go through the parts of Lovanax. Lovanax has 3 parts: needle, plunger, and safety device. Safety device is something you activate after you're done injecting yourself so that you do not end up hurting yourself or anyone else around you. Now we will be going through a step-by-step technique on how to use Lovanax injection. First thing you want to do is wash your hands and let them dry completely. Tell your patients that it is necessary for them to wash their hands before they even touch the Lovanax, because washing hands would eliminate any chances of infection at the injection site. Before starting the injection process, tell your patients to give themselves enough time and space so that they're not rushing through the entire process and making mistakes. You can sit or lie down while injecting yourself, but make sure you can see your abdomen so that you do not end up injecting in the wrong area. Lovanax should be injected into the abdomen. You can either choose left or right side of the abdomen. Tell your patients to use only abdomen as their injection site, and if for some reason that is not possible, then tell them to talk to their physicians about this issue. Lovanax should be injected at least 2 inches away from the belly button, and it should never be injected into the bruised or tender area. One thing you want to tell your patients is to rotate their injection sites. Injecting at the same spot over and over again can cause pain and bruising. So if they choose to inject on left side of the abdomen, then maybe they should inject on the right side of the abdomen the next day. Clean the injection site with alcohol swab and let it dry completely. If while injecting your skin is still wet with alcohol, then that can cause burning. Now take the cap off the needle. While you're removing the cap, just pull it straight out. Do not twist the cap, because if you twist it, you might end up bending the needle. Once you remove the cap, do not put your needle down or let it touch elsewhere. Hold the syringe in your hand as if you are holding a pencil. So for this step, it's better if you use the hand that you normally use for writing. With your other hand, make a fold in your skin by pinching the area of your skin where you will be injecting. Insert the needle into the fold at 90-degree angle. Make sure the entire length of the needle goes into the skin fold. With the help of your thumb, press down on the plunger until no medication is left in the syringe. You want to make sure that you keep holding the fold of your skin until the syringe is completely empty. This is to make sure that the medication only enters the fatty tissue and not the muscle. After you're done injecting, pull the needle straight out at 90-degree angle, and now you can let go of your skin fold. Once you remove the injection from your skin fold, do not rub your skin because that can cause bruising and pain. Before you throw away the syringe, you want to activate the safety shield so that no one gets hurt by the needle. In order to activate the safety shield, make sure your needle is pointing downwards, and then all you have to do is push down on the plunger to activate the safety shield. Once you're done with your injection process, you want to discard your used syringe into the sharp container. If your patients do not own a sharp container, you can recommend them to make their own sharp container. So what they can do is they can use detergent bottle or bleach bottle, something that is rigid, leak-proof, and puncture resistant, and has a tight fitting lid, and ask them to label it as a biohazard and as well as a sharp container.